So first, I would like that on behalf of the National Institute on Minority Health and Health Disparities and the member of the Scientific Review Branch, thank you very much for your participation in the review of these applications that were submitted for the Loan Repayment Program 2023. So these are the topics for the webinar. First, there are responsibilities and expectations. There are the LRP application have different types and are distinct. So we will evaluate the loan repayment application, and there are important do's and helpful tips. The responsibility and expectation. So the general integrity of the peer review at NIH include include integrity, and it's also so for the LRP application. We rely on you to have to accept and observe certain responsibility and expectation. And this responsibility include the attention to confidentiality and conflict of interest, independent preliminary evaluation of the application in advance of the meeting, a final scoring score that we consider opinion of other reviewers, and the revision of the written critique to account for modification of opinion and the final score. So there are different types of LRP application. There is, and all this, the program is made to recruit and retain health professional in good research career. So NIMHD participate in 3 programs, the L32, the L60, and the L70. So for the L32 award, the application must engage the applicant must engage in clinically oriented research of any kind. A health disparity research focus is absolutely not required for L32. L32 is for underserved population. It's underserved population, but it's not. The research doesn't have to be about health disparities. For the L60, the application, the work has to be about health disparity research. For the L70, which is a bit new for NIMHD, the program must engage in research career that pursue major gaps in biomedical and biobehavioral research, and or research in emerging area critical to human health, as well as research in health disparity. So all DIC also have L70, but we have for NIMHD, we have a special list of research that has to be done. So both L32, 60, and 70 program accept renewal application, and a renewal application should include information that account for research accomplishments during the previous award period, and should document progress developing into an independent investigator. We have also type 9 application when it's a type 2 application that was transferred to another, from another IC. So in your review of application, please remember that the loan repayment award are for loan repayment, but not for the funded research. So in reviewing this application, you should consider an applicant trajectory and potential for developing a research career in clinical research or health disparity research, or in major gap in research. The focus you need to look and focus on the merit for the person at their current stage and avoid criticisms of applicant being junior or versus senior. So it's just where are they in their career stage? And importantly, do not compare across application. Each application should be evaluated for its own merits. We know it's challenging to not take into account the merit of the science proposed by a loan repayment applicant. The reviewer should evaluate an individual potential to develop into an independent investigator. Do not take into account the research strategy or technical aspects of the research project. This part as more likely being already reviewed by another review panel. Rather focus on the research the applicant proposes will foster a career development. There are reference letters in this application. They are not in the application, so you will have to click on several links to find each of the reference letter. But they are important. They attest of the applicant research capability and the career development. If there is a need for mentoring and it become appropriate for the PI to have a mentor, please look at the qualification of the mentors for the role and the adequacy of the mentoring plan and the support career trajectory of the applicant. Also look at the research environment's ability to support the career of the PI. This slide shows just an example of a template that changed a little bit since the slide was made, but very little. So this one is for an L60, but they are very similar for the L32 and L70. So in the IRS system, you will be able to see a specific template that should be associated to each application. So with the name and the name of the applicant and the application number will be already built in a system. So the template is going to guide you. Please, could you mute? So the template will guide you through all the review criteria, and each criterion or review factors needs your selection of a rating and entry of comments. On this template, on this slide, you see that it's optional. We now ask for you to write 1 or 2 sentences to tell us why you choose a certain rating for each criterion. And you will have a drop-down menu to choose the rating. So, for example, for the evaluation of the L32, which needs to be in clinical research, so 4 factors are considered: the applicant previous training and experience, the proposed research activities during the LRP contract period, the commitment to a research career, and the strengths of the reference letters. In addition, the quality of the environment for preparing the applicant for a career in clinical research is also need to be assessed. The 2 factors include the quality and availability of colleagues and mentors. If the PI independence has no need for a mentor, it is not required to have one. So also the quality and appropriateness of institutional resources and facilities. Evaluation of L60 is very similar, but the research that they are doing need to focus on health disparity. So the assignment assigned to you have already been pre-screened to ensure that they focus on health disparity research, so you don't have to determine that point. But again, you will have to use the drop down and assign criterion score and write short comments. And the criteria are very similar to L32. Sorry. So for the L70, I don't remember if it's here, I cannot see. So for the L70, it's the same. There is an evaluation form that should be already assigned to the application. And the criteria for the L70 application are awarded the same as those for L32, but which with a focus on research in emerging area of critical to human health and health disparity. And later on, you will see a list of what they are for NIMHD. I don't know why I cannot go forward. Okay. Okay, now there are important something very important that you need to do. So first, when your panels open, and I will have a slide later on that will say the date when your panel should open, you need to verify that you have access to the IAR comment and the accuracy of your SPRS registration, which is to receive your honorarium. You need to contact the SRO immediately if you see new conflict or some other issue. Please do it as soon as possible for things to be able to be, the problem to be resolved. You need to complete the confidentiality and conflict of interest certification. It will be good for you to mark the deadline and the meeting dates on your calendar. And start early and read assignment to ensure you have all information. So the preparation of critiques. So it is important to note that the reference letters are not in the whole of the application, but once you open the application, you need to click on each link to be able to read the letters, which is a little bit different from what it was before, where the letters were inside the application. There are several items to remember when preparing your written critique. Always use a new evaluation form for each application assigned, but and also this is a little bit new maybe for some of you, but a template should be associated with each application in IR. And the template has the name of the PI and the number of the application. Also, never copy and paste from other evaluation form. Do not confuse the goal of each loan repayment program. So panel 1 will be the renewal of L60 that are coming back from previous year. Panel 2 and 3 will be 1 L60, so new application. And panel 4 will be L32 and L70. So make sure you have the correct role of all this loan repayment. Please remember to rate each criterion on the evaluation form. So select a rating adjective, pull down and provide 1 or 2 sentences of opinion for each factor. And this is so a little bit more so that previous year we're asking you to really put 1 or 2 sentences of comment for each of the criterion. If the application is a renewal, there are a few more criteria to answer to. Finally, you will assign a preliminary overall score from 1 to 9, 1 being the best and 9 being poor. And so you will summarize the overall assessment of strengths and weaknesses in 4 to 5 sentences in the overall merit summary section. Submission to IAR. So it's very important to follow the requested submission deadline, since your critique and score are needed before the scheduled meeting days. And they are needed for your colleague to read your critique and see, have an idea if they agree or disagree, and if they want to change any of their evaluation. So after completing your preliminary critique, you upload the critique into IAR, the Word document into IAR. So remember to enter your preliminary overall score, but do not enter criterion score. You will see that the system has a space to enter a score for investigator and approach and all that, and you don't need to put anything in this. You just put it in a place where you say preliminary overall score. Examine your critique and overall score in IR after upload, and ensure the uploaded critique matches the application, and that preliminary overall score entered in IR matches the overall score within the critique template. It happened that someone in a critique template said they want a score of 3, and there is a little error made when they go in IR and the score is a 2. So it's important to check. During the internet meeting date, you will need to consider the comment and rating of your colleague reviewers as posted in IR. Communicate any discrepancy and score concern, as well as score changes to the SRO of your panel. And you communicate by email and respond to messages also and query from the SRO. The SRO will send you on the morning of the meeting for you to read your colleague critiques, and if there is more than 2-point differences between between the 3 reviewers, a specific email should be sent to you, and have a very hard look at it and see if you want to change any of this of your critique and score. You must enter in IR a final score for your assigned application. So previously you had the preliminary score, but also once you decided that this is the score you want, you must enter a final score. If you decide to change your score, please modify your comments to reflect the new score. Once all final scores are entered, please sign the post-meeting conflict of interest and confidentiality certificate form. So here is the important deadline. So panel 1 should be open, and the RS submission is due on February the 20th, and the meeting will be on February 21, 22nd. Panel 2 should open by the end of the month, with critique due March 6th, and final score in IRA on 7 to 8. And it continues like this 2 weeks apart. So it's very important to have this submission deadline on time. This is a summary of what the review process should be. You identify potential assignment conflict. You sign pre-meeting reviewer conflict on the form in IAR. You review the application and prepare critiques using template. You submit your critique and preliminary score in IAR by deadline. You make sure the correct critiques are for the applicant. During the meeting, you review the critique and scores of other reviewers. You vote a final overall score for your application in IAR, and you revise written critique to reflect your final overall score. Complete post-meeting conflict also form in IAR. To assign the pre-COI, you will see you have loan repayment application are grants, are not grant program, they are contract. So you will see a place where you have to check if you have no conflict, or if you have conflicts, make the difference between where it's grant and where it's contract. So loan repayment program are contract. So the next few slides are kind of few definition. I'm not going to read all of them, but for example, whom is an independent investigator? After there is information on the L32 definition of what clinical research is, and definition on L60, and definition of health disparity research, and also who are the health disparity populations. For the L70, this is the list that, since many, a lot of IC also use this program, each IC has their as their list of research that they want to see, and this is the list that NIMHD has. Resources. So in addition of this this orientation, and you have other resources that are indicated on this slide. And here are all the contact of the SRO that are responsible for each of the panel. So I would like now to thank you for your willingness to participate again in an NIMHD review of this application. And we hope that you have found this review orientation to be informative, and that it will assist you in the review. Please contact any of us if you have questions. Thank you.
Marilyn, there is some questions in the chat.
Okay, let me go. I'm okay. Okay, can you clarify what it means to evaluate research activity relative to other screens saying not to evaluate the science? So the research activity is about health disparity, or is it about clinical research, or is it about the gap? So it's depending on the program. But the research, the science itself, so if they apply for a loan repayment, is because they have research that is already funded. So you do not have to review the science per se. It just need to be a science that will allow for them to become an independent researcher in health disparity or in clinical research or for the L70 program. What if the applicant indicates they are independent, but the reviewer feels they should have a mentor? So you can indicate that in the template. And there is a drop down that say it's an independent applicant, so it doesn't need anything. But if you think that it needs something, please do it and see it for your score. It's something you can decide. When is the meeting days? So let me go back to my slides. So so the meeting days are depending on the panel. The meeting days are that February, March, and April. It's anachronous. I don't know exactly. I don't understand that question. So Ivan, you said there are 4 review panels with 4 different meeting dates. Yeah, there is no actual meeting. So yeah, it's on email. Everything is done on email. It's not even like we had some time. It's not on virtual. It's not on Zoom. It's nothing like this. It's just through email. On the morning of the meeting, the SRO will remind you to check on all the scores and on all the critiques. And they will have an exchange of email between you and the SRO. The SRO should also, if there are more than 2-point difference between the scores, the SRO will send you a specific email to encourage you to really look at it and see if you want to change anything. Do not forget that if you change something, if you change the score, please change your comments that will reflect your score. Are you going to share with us this presentation? This presentation is being recorded, and I will send the link. Thank you. It was meaningful and useful. I hope so. But please, if you have any question, do not hesitate to contact any of us on the last slide. So can you summarize again what comment we will expect to write and where to write them? You have mentioned some places where we will not expect to write comment. No. So you are expected to write comments. So I show you the example of a template for the L60. So it's in a template, you have room to write your comments and to use the drop down to indicate which adjective you want to put on this comment. The last, when you do the summary of your critique, it's a number. It becomes a score number, and you will choose that score number, I suppose, depending on your adjective that you put earlier. It's and previously the comments were optional, and is what is on the template. It was optional, but we're expecting now that the comment for each criterion be included. It's easier for us to understand your final decision. So if you can, please do not think the comments are optional anymore. And on the template, on the new template, it doesn't write that it's optional. And you say expect to write, and where, yeah, so where to write them, it's on a template. And the comment we will be expected to write, this is you to see. You for example, if it's an L32, do not say that there is no health disparity work being done, because it doesn't have to have health disparity to be done. So you don't want to go that way. Do not compare application in your mind. Try to see that it's to see only what the applicant is writing. Do not see it's a junior applicant, or It's a more senior one. Just see what the applicant can do with what is written in the application. SROH panel will email reviewer about review procedure. Yes, more information, everything will be emailed to you at the time before the meeting open, or the day the meeting open, you will be made aware that the meeting is open, and you will receive an email from the SRO and from the IAR system. So more information will be sent to you for sure. And but still, you can still call us if you have more to ask. Any more questions? So I don't see any more questions. So I'm going to stop the recording.